How to inject Menopur with a mixing needle, subcutaneous. Presented by Fuze Health. How to store your medication. Store Menopur at room temperature or in the refrigerator until the expiration date on the label. Once mixed, it must be used immediately, and any unused portions should be discarded. Supplies needed. You'll need 1 vial of diluent, at least 1 vial of Menopur 75 IUs powder, depending on your dose. For example, if your dose is 75 IUs, you will need 1 vial of powder. If your dose is 150 IUs, you will need 2 vials of powder. If your dose is 225 IUs, you will need 3 vials of powder, and so forth. For today's injection, we will prepare a dose of 150 IUs, or 2 powder vials, 1 3 ml syringe, 1 mixing needle, 1 injection needle, alcohol swabs, sharps container, gauze or tissue, optional. Examining your medication. Before starting, wash hands thoroughly. Work on a clean surface and inspect your vials. Ensure the powder vial has no cracks and contains powder inside. Diluent should be clear and particle-free. Prepare the medication. Flip off the caps from all your powder and diluent vials and wipe the stoppers. Assemble your mixing needle and syringe and remove the cap. Pull back plunger to draw air into the syringe that matches the amount of diluent you are instructed to mix with. For Menopur, it is typically 1 ml. Insert the needle into the diluent and slowly inject the air. This step makes it easier to withdraw the liquid because the vials are pressurized. Invert the vial and withdraw your prescribed diluent amount, for example, 1 ml. Ensure the needle stays submerged by slowly backing the needle out of the vial as you withdraw. This ensures you are drawing liquid and not air. Remove the needle and discard the used vial of diluent. Locate your first Menopur powder vial and insert the needle through the stopper. Slowly inject the diluent into the powder. Menopur dissolves instantaneously, but you can swirl the vial to make sure it's thoroughly mixed. Do not shake. Invert the vial and withdraw the entire contents of the vial back into the syringe, keeping needle tip submerged. You have now mixed 1 vial of Menopur powder for a dose of 75 IUs. If your dose is 75 IUs, you are done and can skip to the injection steps. If your dose is more than 75 IUs, continue to the next step to mix your subsequent powder vials. Locate your second Menopur powder vial and slowly mix it with the mixed solution from your first vial. Swirl to make sure it's thoroughly mixed. Invert the vial and withdraw the entire contents of the vial back into the syringe, keeping needle tip submerged. You have now mixed 2 vials of Menopur powder together for a dose of 150 IUs. If your dose is 225 IUs, mix 1 more vial of Menopur powder with this solution. If your dose is 300 IUs, mix 2 additional vials of Menopur powder, and so forth. After you are done mixing, recap the needle by scooping the cap up with your needle to prevent needle sticks. Twist it off and discard it into the sharps container. Switch to your injection needle. Tap out air bubbles and push the plunger gently until a droplet appears. How to do a subcutaneous injection. The abdomen is the most common area for a subcutaneous injection, but always check with your provider to ensure you are injecting at the right location. You should inject at or below the level of the belly button, roughly 1 to 2 inches away from the navel. Avoid injecting directly below the navel because that area is very vascular and can lead to more bruising. Always rotate your injection sites to decrease discomfort. You are now ready for your subcutaneous injection. Clean the injection site with alcohol. Gently grasp a 2-inch fold of skin at the injection site with your non-dominant hand. Hold the syringe in your dominant hand and insert the entire length of the needle at a 90-degree angle. You can insert the needle at a 45-degree angle if you have less body fat. Push on the plunger slowly until all of the medication is injected. When done, release the pinched skin and gently withdraw the needle. Discard the used needle into the sharps container. Apply light pressure. Bleeding, bruising, or redness at the injection site is common. You might also see a drop of liquid come out of the injection site. This is common and should not be of any concern. Great job! You have completed your injection. If you have any questions or need support, contact your healthcare provider or reach out to Fuze Health.